First question on the final exam is going to be many parts, and it's going to have to do with a variable where I have to identify the variable, have to identify the population, have to identify what type of variable it is, and other questions like this. This question is going to have 5 parts, 5 answers, be worth 5 points. Hopefully, I'm giving you an easier question that's worth more. So please make sure that as you're going through these multiple choice possibilities, when you take the actual final, you're stopping and really thinking about them, because these are worth as many points as harder questions coming later in the final. Here in the sample test, it tells us a researcher wants to estimate the survival time of a cancer patient after radiation. First thing it asks is, what's the variable of interest? So the variable interest is what they're trying to estimate. In this case, they're trying to estimate the survival time of cancer patients. So my variable of interest would be survival time. When it then asks, is the variable qualitative, quantitative, continuous, or discrete? First thing I need to consider is there a naturally occurring numerical scale underneath survival time? There is. This patient who got radiation survived another 3 years. This other patient survived 1 year. I could line everybody up based on how long they survived after the radiation. So I know that it's going to be quantitative for that reason. Remember, quantitative is there's a naturally occurring numerical scale. Qualitative is if I can just put it into categories. Now that I know it's quantitative, I have to choose between continuous or discrete. If it had been qualitative, it would automatically be neither. The choice between continuous and discrete is really saying, can I have parts of a whole? Well, if we think in terms of years, it's obvious that somebody could die in the middle of a year. It's not like everybody is surviving up until January 1st and they're all in 1 year increments. For that reason, this would be a continuous variable where I could have parts of a whole. The same would hold even if I went down to days or months or anything that's a smaller unit of time. I still could have part of a whole in this situation where there's nothing saying that the survival time has to be an exact whole number. Part C asks, what's the population of interest? So if we go back to what the researchers studied, they want to estimate the survival time of the cancer patient after radiation. This after radiation is key. They don't want to just look at random cancer patients because some of them might not be as far along, some of them might not have been recommended the same general treatments. Here, if we're specifically looking at ones that are undergoing radiation therapy, that should be in our description of the population. So what's the population of interest? Cancer patients that underwent radiation therapy. Part D, how can a researcher select this sample? I really would rather not include this part of the question. I honestly don't remember if the one on the final has things that are as open-ended as this. My understanding is they're very lenient with the grading online here. It just says answers may vary. But really, how could a researcher select this sample? I could just randomly select (100) patients from a local hospital. If I did just randomly select 100 patients from a local hospital, what problems might occur from this sample? Well, one of the issues may be that the patients are in different stages of cancer. So it might be that I get 100 patients who just started radiation and really weren't that bad off to begin with, or I might get 100 patients that are really far along in the treatment and probably don't have as good a chance of survival past where they are. So if I'm just randomly selecting the patients, I'm not really controlling for how far along their cancer is. So that's one of the problems that might occur. There's literally 100 different things that you could write here for other problems that could occur. Age could be a problem, that we get older patients or younger patients than we should. There's a lot of different factors you'd have to control for here. What I'm going to write in this specific thing is there may be different stages of cancer we have to control for. So the key things you need to take away from what you want to be able to do for this question. First thing you want to be able to do is identify what variable do they care about. Second thing you want to be able to do is say for that variable, is this qualitative or quantitative? If it's quantitative, is it discrete or continuous? Last thing I'm most interested in you being able to do is identifying what population the researcher really cares about. So this A, B, and C is really what I care most about within this question. Again, if there are parts like D and E, it says in the grading answers may vary. I'm pretty sure that they give you credit as long as it's something reasonable that you type for